Knowing that you've been diagnosed with narcissistic personality disorder, or NPD, may seem unsettling at first. But with the help of long-term counseling and talk therapy, you can learn how to better manage your personality disorder in a healthy way. Talk therapy, also known as psychotherapy or cognitive behavioral therapy, is a treatment process in which you work with your therapist to get at the underlying issues related to NPD. These one-on-one therapy sessions may occur over the course of several months, sometimes years. During these sessions, your therapist will help you gain an understanding of your diagnosis, address challenges and concerns you have, and recognize problematic thoughts or behaviors you participate in. Over the course of treatment, you and your therapist will identify healthy coping mechanisms that you can use to minimize the severity of outcomes that are associated with NPD. Over time, these practices will become easier as you adopt positive, healthy emotions and habits. If you're a person with NPD, you may be hesitant about therapy at first, and whether or not it will be helpful to you. Maybe you start therapy because someone has deeply hurt your feelings and made you question aspects about who you are as a person. Or maybe a friend, loved one, or family member insisted you go to therapy and you agree. On the outside, you may appear confident, but in truth, you may be unknowingly hypersensitive to criticism or the fear of failure. If you're having second thoughts about therapy, or you're hesitant about the idea, you may want to work with your therapist to address any concerns that you have. From there, your therapist may work with you to identify narcissistic behaviors that are causing problems in your day-to-day life. Maybe you find it hard to maintain long-lasting relationships or create new connections. By analyzing what's happening and what's happened to you in the past, you can find ways to strengthen your relationships in the future. So much of NPD relies on your perception of how other people view you and how well you establish your own self-worth. Much of your therapy may be focused on boosting your self-esteem in positive ways and establishing realistic goals and expectations. To achieve this, you may be given homework or activities to do outside of therapy. Keep in mind that what works for you may not work for someone else, so the key here is to explore and discover the tools that will be most helpful to you. To date, there are no set medications that directly treat NPD, but your doctor may prescribe medications to treat symptoms and underlying conditions, like anxiety or depression, that have the power to amplify NPD. These medications include antidepressants, mood stabilizers, and antipsychotic drugs. In many cases, these medications can be paired with talk therapy for long-term and short-term treatment. But talk therapy can work as a treatment all on its own, too. If you think you have NPD or have recently been diagnosed with NPD, talk to your doctor about your concerns and see if talk therapy is right for you.